Now let's dive deep into this big LGBTQ story for today. I'm Von Biggs, and let's queer up health. Screening at 35 could cut anal cancer deaths by 65% in gay bi men with HIV. A new study is shining a powerful light on anal cancer prevention, and it could save lives in the LGBTQ community. According to the research published in the Annals of Internal Medicine, starting anal cancer screening at age 35 for gay and bisexual men living with HIV may reduce death rates by as much as 65%. Anal cancer cases in the U.S. are on the rise, with over 10,000 new cases each year and mortality increasing at more than 2.5% annually. Men who have sex with men, especially those living with HIV, are at particularly high risk. The study used a microsimulation model based on data from the landmark Anchor trial and other sources. Researchers compared 52 screening strategies, including the costs, outcomes, and life years gained. The bottom line, screening at age 35 with anal cytology proved more effective than starting at age 40 or 45. Several approaches, including annual or biennial screenings using HPV testing or cytology with HPV triage, showed meaningful reductions in cancer cases and death. Dr. Ashish Deshmukh, professor of the Medical University of South Carolina's Hollings Cancer Center, said, ICER, or incremental cost-effectiveness ratio, is a way to measure whether a medical intervention is worth the cost by comparing how much it costs to how much it improves the health. That improvement is measured in QALYs, which stands for Quality Adjusted Life Years. QALYs reflect both the length and the quality of life gained from a treatment. In this study, starting anal cancer screening at age 35 for gay and bisexual men living with HIV was shown to be cost-effective, with an ICER under $150,000 per quality gain. This means that screening provides more value for the investment and has the potential to save lives while using healthcare resources wisely. Right now, there are no national guidelines for anal cancer screening from bodies like U.S. Preventive Services Task Force of the American Cancer Society. Deshmukh hopes this study changes that. Quote, our study addresses the long-term uncertainty and knowledge gap about whether screening for anal cancer reduces mortality. This suggests that we may need to reduce uncertainty around uniformly screening for anal cancer at high-risk individuals, especially for MSM with HIV, end quote. For LGBTQ people living with HIV, this research could help shift the conversation and policy toward earlier life-saving care. You can read the whole article at hea.gov/